Hey, what's up? Welcome back to my channel. In today's video, we will be talking about PICC lines. In particular, focus on the anatomy of the PICC line, go over a general review of uses, and also go over the central line dressing. However, before we get into it, if you're new here, welcome. My name is Tina, nurse practitioner. Don't forget to subscribe and turn on that notification bell. Let's get started. So a PICC line is also known as a peripheral inserted central catheter. The origin of access is the peripheral vein, where it is inserted through sterile technique through a trained provider through the basilic vein, or it could also be the cephalic vein. And then it's guided through a wire where it goes into the right subclavian vein, into the superior vena cava, into the right atrium. Once it is in the right location, then the provider will put a central line dressing, will secure it, and then a chest x-ray will be done. During the procedure, the nurse is responsible for checking for any type of ectopy or any type of PVCs on the monitor, because if the catheter is advanced too far, it can cause ectopy or cause an abnormal arrhythmia. So you want to make sure that you get the x-ray done before infusing any type of IV medication through the PICC line. So never use it until it is cleared and okayed and you physically have an order okay to use PICC line. Common uses for a PICC line: it can be used for short-term and long-term use, such as parenteral nutrition, also known as TPN, which is your total parenteral nutrition. It can be given for chemotherapy. It's also used for IV antibiotic therapy. That can be long-term, and if the patient needs to go home and they're homebound, they can go home with a PICC line, or if they need in an ICU setting vasoactive drip such as dopamine and it can't be infused through a peripheral IV, this would be given through the PICC line. So those are some common uses. And also patients that need frequent blood draws, that's another reason why it's given. So moving on to the anatomy of the PICC line, this can come in a 5 French or a 4 French. It can vary. However, this is a very long, soft tubing, and it's nice and round at the end. If you see here the anatomy of it, it says polyurethane. So the difference with this one versus others that can be silicone, this one's a little bit stiffer. So when it's guided through the veins, it is a little bit stiffer, but once it makes contact with the vessels, it tends to soften over time. As opposed to the silicone, it's a lot softer. The other thing with the PICC line is you will notice there are markings throughout the PICC line, and it goes all the way to 55, 56, 57, 58, 59 centimeters. What's important for you is when the patient physically has this PICC line in place, there's gonna be little markings, and you're gonna want to note the markings. So when you get report, they may say, you know, a double lumen PICC line was placed and it's marked at 2 centimeters. That's what they're referring to. So if you were to do a dressing change and let's say accidentally it moved when you're changing out the stat lock, and now you see 3 centimeters, then you want to know that this could have possibly been moved. So you're going to want to stop the infusion, notify the doctor, get a chest x-ray, and just make sure, confirm placement that it's in the right place, versus if it was advanced even closer, and vice versa. So that was one thing I wanted to highlight. The other thing is PICC lines can be single lumen, double lumen, or triple lumen. So this, what we're looking at here, is a double lumen, and so these are referred to as the lumens. And what that means is if this is a double lumen, then at the end of this catheter, it's bifurcated, so there's a slit in between here. So that means it's shared. So we can attach two medications on here, but when it's infused, there's just, it's infusing, and there's two different ports of where it's coming out from, the medication. Now, if it was a triple lumen, then again, the more lumens that you have, it reduces the size and the flow rate. So you always really see a double lumen. This is ICU preferred. If you see a single lumen, if you are an ICU nurse, you will probably cringe and be like, oh no, why is it just a single lumen? If this was specific for TPN infusion, you're gonna wanna do a designated line. So we'll say, okay, this one is specifically for the TPN. We are not gonna move this around. We're gonna keep this line for TPN because it can coat the medication when it's infusing, can coat the line, and so preferred, they always want to make sure you just keep that line specific for TPN and it's designated. These on the bottom are your needleless connectors, and of course this is not sterile technique right now, but these are your lure locks that you would attach it to. So if you detach this one here, obviously this is not sterile technique, like I said. And then you can remove this clear cap. You can attach it to here. And then now this looks like a PICC line. So then you'll remove the clear cap and then you would attach it to here, assuming that you pre-primed it with saline. And then these are your clamps. So you want to have it clamped when it's not in use, and you want to make sure that there's no air bubbles and that there's no blood flowing back into the actual lumen. So this is where you have your wings, and then this is where you're going to attach your stat lock. And I wanted to bring this to your attention because I think this is the most important skill set, is getting comfortable when you're actually changing the dressing. You have to change the stat lock. And so what I want you to do is, before you ever change a PICC line, I want you to get comfortable with putting on a stat lock and removing it and feeling comfortable with it. So when you do attach this stat lock, in the back there's two little wings where there's stickers. That's what's going to apply to the patient's skin. So when you put it in, it's supposed to align with those blue little tabs. You have to forcefully click it in, and then on the other side as well. And then once that's clicked, you hear those two clicks, then you're going to take off this sticker, and this is where it's going to apply to the patient's skin. So you'll remove one and then the other. The other thing that you will be applying to your PICC line is a bio patch. So this is what the bio patch looks like. It's like a little film that protects it. So based on the insertion, where it was inserted is where you're going to place it. And then let's talk about what's inside a central line dressing. So you want to take a look and read the packaging before, because sometimes you have to throw in some items into your sterile field. However, it will always come with a mask. Sometimes there's two masks, one provided for the nurse and one for the patient. In this packet, there's just one, assuming you already have yours on, your sterile gloves. And then you have your CHG prep that you're going to use. You would click it and then shake it, and then this is what you would clean the patient with for the PICC line. You have your drape, you have your forceps. If you're physically gonna remove the PICC line and there's sutures there, you can use that. Then that means you would also need some sterile scissors to throw into the field, and then your Tegaderm and 2x2 gauze, and then if you needed a little Q-tip to clean as well. So those are some of the most basic things that are included in the kit. Again, you would need your stat lock thrown in, and then your lure lock, sterile ones, 2 of them, and then your bio patch. And I always like to throw in at least 2 or 1 minimum, a 10 cc syringe sterilely into the field as well. If you find value in this content, don't forget to give me a big thumbs up, comment below, show some love, and I'll see you on the next one. Take care.